It turns out that the larger pharmacies seem to be making many of the mistakes because it appears that the mistakes are generated by filling too many prescriptions with too few people.
Attorney Trent Speckles goes after big pharmacies for making big mistakes.
I don't know anyone who finds out how big a problem it is that wouldn't be shocked.
Tonight, Channel 2 is revealing trouble behind the counter of Georgia's largest pharmacy chain. State regulators are giving CVS until the end of the year to make some changes. Consumer investigator Jim Strickland found patients who found mistakes in their medicines.
Gervita, this consent order documents problems at CVS pharmacies in Georgia dating back to January 2004. Investigators say they have reports of dozens of errors, and they figure that's just a fraction of the mistakes that actually happened. This order is designed to keep CVS from giving patients the wrong pills.
These wrong pills, for instance. 10-year-old Austin Stowe was the patient.
My mom was just going to CVS to pick up the medicine.
Last year, Austin and his mom, Jamie, had strep throat. Austin's doctor prescribed an antibiotic. We have a copy of the record from this CVS in Covington. It lists amoxicillin as Austin's only prescription.
I took the pill and she told me to throw it back up.
This is the pill. It's not amoxicillin, it's 800 milligram ibuprofen.
It was actually an adult pain medication, and it was a very high dosage. It was not even an antibiotic. He needed an antibiotic.
Jamie Stowe was supposed to get the painkiller, but Austin's name and that drug wound up on the label.
They're supposed to know how to put the right drugs in the thing and put the right label for the right person.
I did blame myself because I am a parent, and, you know, we do everything to protect our children.
State regulators are punishing CVS for mistakes like this. They demanded CVS pay a $75,000 fine, and by year's end, CVS must provide additional training to pharmacists and technicians, and the pharmacists are now supposed to do the scheduling.
Scheduling is crucial. I spoke to CVS pharmacists past and present. None would go on camera for fear of reprisals, but one told me he worked 14 hours straight and wouldn't drink anything because he didn't want to have to go to the bathroom. He said during one of those shifts, he and several technicians would fill between 300 and 400 prescriptions.
The Board of Pharmacy would not have taken action unless that they had felt that there was a valid reason.
Sharon Shearer is president of the Georgia Pharmacy Association. She says pharmacists working anywhere that they feel patient safety is compromised should take action.
I would probably report it to the Board of Pharmacy, and I would seek employment at another practice setting. I just don't think I could practice there. Every pharmacist has to make their own decision.
It turns out that the larger pharmacies seem to be making many of the mistakes because it appears that the mistakes are generated by filling too many prescriptions with too few people.
Attorney Trent Speckles goes after big pharmacies for making big mistakes.
I don't know anyone who finds out how big a problem it is that wouldn't be shocked.
Right now, I just do a little walking mainly.
Melvin Boyce got the right pill but the wrong dosage at this CVS on Boulevard. A kidney patient with an infection, his doctor wanted Boyce to take medicine every other day. Yet the label reads, take a pill a day, 7 days straight. Boyce remembers the pharmacist's reaction.
Well, those things happen. They do. I'm surprised to know that. I mean, you are admitting that this happens. I mean, how often does it happen?
Jamie Stowe is hopeful it'll happen less often since the state is watching.
I'm glad that something is going to be done. I do think they need a wake-up call. I do not think they...
Now, CVS refused to talk on camera, refused to answer our questions, and would not let us in their stores. They gave us a statement that says CVS makes high-quality health and pharmacy services safe, affordable, and easy to access. CVS Pharmacy and the Georgia State Board of Pharmacy stipulated that there was no admission of liability for any of the allegations. CVS is now working with regulators, they say, to make sure that the changes are made by the deadline as called for.
So what's a consumer to do? How do you protect yourself?
Well, here's the deal. If the doctor says, I'm going to give you something for the pain, don't leave it at that. Ask what that something is, both the brand name and the generic, if there is one. Make sure you are clear on the strength and how often to take it. And then When you pick it up, check the label and ask the pharmacist to go over it again. You have the right in the state of Georgia to counseling at the pharmacy counter. I can tell you this, state regulators say since they took this enforcement action, the number of complaints about CVS is way down. But before, it was higher than even the bigger pharmacies like Walmart, Publix pharmacies, Walgreens. CVS was far above all of them in the number of complaints.
Okay. Jim, thanks.